Go ahead.
Good evening to all our viewers. Welcome to another session of Facebook Live. Today we have with us Dr. Sayali Chavan, fertility specialist at Oasis. Our topic for discussion today is how does a counselor help you in IVF process? So let's go ahead with the questions. Dr. Sayali, I would like to ask you, what is the basic role of counselor in IVF? How important is it to have a counselor at the clinic?
So thank you. So everyone, Apurva is a counselor. She's at the Oasis Fertility Vacat Center. Okay. So how important is it to have a counselor? Is counselors have a very important role in the overall, journey of IVF. So basically, the initial process as an evaluation of the patient after the history, after his test reports, the diagnosis, and everything, the doctors kind of explain the overall procedure to them. What are the treatment options available, as in what are the success rates and everything. But after that, the entire thing is taken over by the counselors. The counselors have to, at every step of their journey, they have to kind of explain the entire process of the IVF treatment to the patient. Be it like if it's an IVF thing, be it the oocyte retrieval, then the ovum pickup procedures, what are the risks involved, and after the oocyte retrieval, about the transfer, yeah, any therapeutic procedures that are required in between. So counselors, apart from this, they have to also kind of emotionally bond with the patient. They have to understand the problems that the patient is going through, and they have to kind of make the patient understand that how their journey in the IVF is going to be, how then they have to kind of relate to the emotional aspect of the patient, try to allay the anxiety, kind of give them that the positive outlook that the treatment is kind of going to be helpful to them. They just have to hang along and get over. Then counselors also play a very important role in kind of describing the overall procedures when it comes to the donor gametes, then the legal, the ethical aspects of everything. Then explaining the entire procedures, and kind of being emotionally connected, being empathizing with the patient. They kind of know better, they can handle the patient better and even prepare them for the successive results and everything.
Okay, so even though, like you said, doctors explain the clinical process, why is a separate counseling needed? Like, is it because the counselor can connect better with the patients?
It's like when the doctors kind of explain the procedure to the patient, doctors will kind of at one step, explain the entire procedure, what are the steps required for the, treatment, and what all needs to be done, to achieve the success. But the, patients are kind of after their prime counseling section, they are kind of, in anxiety or fear that what is going to happen in the overall procedure. And if the doctors are not able to cater to the needs at that time, the counselor kind of gets to understand the patient better. They kind of can explain to the patients what are the problems that are related, and they kind of, if they have any emotional problems, or they are dealing with some anxiety or any fear related to the thing, the counselors can kind of better explain them the procedures. And there are infertility is like a, it's a big turmoil. The patients have to go through a lot of things. It's has a bearing on the biological, be the psychological, social, ethical, on all grounds these counseling aspects are needed. So counselors kind of help them even to get their interpersonal relationship better, help them be emotionally strong, to deal with the pain or to deal with the entire prolonged procedure that they're going through. And coming to the financial aspect of the counseling, the counselor, when they explain the overall financial thing. So when it comes to individuals with a low ovarian reserve, or individuals who have multiple factors of infertility, so they, by explaining the financial aspect, they can even get the patient kind of ready for the overall finances, so that they can be even prepared financially about the entire thing, so they don't have to stop the treatment or go for some lower cost effective treatments for them. When it comes to the donor gametes, explaining the legal aspects of the treatment and what all, what are the future implications of them. Definitely, they have many doubts which the counselor kind of can deal with it.
Okay. So, like you told about the aspects which are covered, but at which stages of the treatment does counseling need to be done?
So counseling needs to be done right from the start. Like, when the IVF journey starts, when the patient comes in for the treatment. So what all forms of treatment is required. So the initial part is done by the doctor. Like, analyzing the patient, studying his reports, getting to know what the problem is, and guiding them the treatment and the alternatives that are available. But the later part of the treatment, after the prime aspect, when the person needs some emotional support, when they need, like they want to carry on their treatment but they have some doubts related to it, they want to explore the other options that are available, and how, is it going to be beneficial for them. So in all that aspects, these are the different ways in which the counseling plays an important role. So here, the first aspect, we have the support counseling. In support counseling, what happens is we have to kind of emotionally support these individuals, and this emotional support comes right from the start. Like when the patient comes in with a certain problem and there is a diagnosis of this particular condition, so what form of treatment is required? So if the person's prognosis is grave and they require some, extensive form of treatment, which is going to require a lot of financial bearing, or it is going to require an extensive form of treatment, the patient should also be like emotionally, physically, as well as mentally ready for the overall thing. Okay, the support counseling to these individuals is also required in the period when they are awaiting their results. So be it an IUI procedure or an IVF thing. So these patients do require that strong support. They need to be emotionally stable. So whatever the results are, they should be like prepared to overcome. And after all forms of treatment, if at sometimes it happens that one particular form of treatment is not giving them results, and they have to kind of go to more advanced form of treatment, so at least these kind of counseling, the support counseling, that means that you're available with the patient at each and every step and supporting them. These kind of counseling can help the person to kind of plan their further line of management further. you know then the next aspect is the implication counseling. Now, what is implication counseling? What are the implications of the forceps procedure? So, especially in individuals who require donor gametes, be it donor sperms, be it donor oocytes, or be it donor embryo. So, when we are explaining about the donor gametes, all the legal, ethical applications come along with it. So, these patients need to be explained that why is the need for them to go for the donor gametes? Why is the cell gametes not going to give them that much of the results? And that using these donor aspects of treatment are going to kind of improve their fertility results. So in implication counseling, we need to explain them about the legal, the ethical aspects, and how overall about the counseling these individuals about the consents and about the decision making. Like if one of the partner is suffering from some problem where he's not able to use his own gametes, the other partner should also be ready for conception with the donor gametes. And especially in individuals where they cannot conceive on their own, they require some form of surrogacy or adoption. Then in both these cases, we kind of need to explain to the individual the pros and cons of both of the procedures, the cost effectiveness of the procedure, and for which they should like go further. Then after the initial part, like after the initial therapeutic part has been planned, then you have counseled them, you've given them the emotional support, and you've given them the implication counseling. Then comes the major procedure related or your therapeutic counseling. Now, this therapeutic counseling starts from the time go when we start the treatment for these individuals. Now, here, the patient needs to be explained about the entire procedure that they have to go through. So, when it comes to IVF, they need to be explained about the entire oocyte retrieval procedure, the, how many days of follow up they need. So, it's like an extensive procedure where, 2 to 3 months of proper treatment may be required. So when it comes to the oocyte retrieval procedure or the stimulation, they require to come daily for 10 to 12 days, take daily injections, then how the injections are going to be, and how is it going to be like, how are we going to take care that they are not painful or do not cause discomfort to the patient. Then they have to be explained about the oocyte retrieval procedure. The counselors per se have to explain the entire procedure in detail, the risk involved, what sort of anesthesia is going to be given to these individuals. So post retrieval, about the discussion. So what if adequate number of embryos are not formed? So what are the options that are available? Or in male infertility patients where we don't get adequate number of sperms if you're planning some surgical retrieval. So what are the options available? Post getting adequate number of embryos, how is the transfer going to happen? In individuals with thin endometrium, what are we going to do in these individuals? What are the therapeutic options available? So all these procedures should be explained. All the risk related to the procedure should be properly explained to these individuals. A valid consent from the part of the counselor needs to be taken. This should be a proper written consent where the patient and the couple kind of has to understand the entire procedure, and they should be in a place to kind of give their own consent that we have understood everything and we are kind of going ahead with the procedure. Then, after everything has been done, comes your post therapeutic counseling. So, post therapeutic counseling is kind of preparedness for the couple to help them accept whatever results are awaited for them. So initially, only when we are giving some form of treatment and depending upon the prognosis, we kind of give them a success rate. So, what if the results do not come positive? So, we cannot always give a positive aspect to the individuals. We have to kind of prime them even to accept the negative results so that it's not going to have a lot of emotional bearing on these individuals when they do get a negative result in hand. And then again, in the post therapeutic counseling, we also have to kind of explain to these individuals what are the other options available. So getting a negative result is not like the end of the road. It's not that there is no other option available. So if the result comes negative, what are the other options available for the thing? And the very important part is the financial counseling. So when it comes to IVF treatment, it does have an overall bearing on the financial aspect, especially when it comes to women with low ovarian reserve or individuals who have multiple problems of infertility. So in these individuals, some form or other extra additional treatment is required. Or individuals with low reserve kind of might require multiple cycles of stimulation. So you have to kind of prime these individuals initially only, so and so will be the cost of the overall treatment, and he or she might have to pay the extra amount, so they should be financially ready before starting the procedure. So they might not need to stop the procedure in between, or as we have decided they might have not they do not need to go for some inferior line of treatment which will not give them that good a success result.
So when a couple comes for IVF, the one of the most important questions they ask is about the success rate or the success chances of their treatment. So, how important do you think is it to counsel them on it in the first session or in the primary level itself?
Yeah. So when a patient comes to you, as we have, initially dealt in the session, that the patient should be kind of primed as to what is the success of the treatment for this, for the couple, so that they'll be ready for it and they do not have too much of expectations further on. So depending upon the prognosis, depending upon the results, whatever we feel that the success of the treatment is, they should be told the proper results. And based on that, also we kind of have to prime them about the other treatment options that are available. So if they're not able to get a defined success in that cycle, then what are the other treatment options that we can go ahead? So that when supposedly they don't get a positive result, so they are not that much into distress and they are kind of readily accepting those results.
Okay, so there are, apart from the couples, there are individuals who come for fertility preservation due to some personal reason or some medical reasons. So, at what points do they need to be counseled?
Yeah. So when it comes to fertility preservation, the prime indication, like one of the important indications why these young individuals go for fertility preservation, is they have some, condition that is going to be like, they have to go for some extensive treatment, such as some oncosurgery or some oncological treatment, for where they have to kind of, preserve their gametes or preserve their sperms or embryos, whatever. So in these individuals, we have to kind of understand that they're going through a lot of stress, and they are emotionally very low because they are dealing with a life threatening condition, and plus their fertility is also compromised. So counselors in dealing with this thing have to be considerate to these individuals. They have to kind of give them that emotional support and be with them in this journey, because as we know they have to go through some extensive line of treatment, and for that they need the support. So empathy out here is a very important factor. So you have to kind of get into their own shoes and try to understand what these individuals are going through. So especially for that. And when it comes to fertility, preservation in individuals who are like not getting the adequate partner or who do not like want to get married so soon. So in these individuals, they have to be told that, if they do not get married early, so at least preservation of their oocytes or preservation of the sperms can at least give them a chance for achieving fertility in the future.
Okay. So, counseling at each stage to the couple or to the individuals. How much do you think counseling influences in the decision making of the couple for the treatment?
So like when start right from the starting, when the couple comes to you and he's counseled about the, what is the reason for the infertility, what are the treatment options available, what is the success rate, and what are the alternatives available. So this is like an informed consent to the individual. Like the individual knows what are the options available, he knows what is the success rate of each form of treatment. And when we are counseling at each stage, like be it the cost of bearing the entire procedure, or be it the physical pain that they have to go through, or the time interval that is required for the conception and everything. So here, when we are counseling the individuals about the varied options available and which option is best suitable for these individuals, it will kind of help the individual to make an informed decision. So they kind of know the alternatives available, and they know which is the best alternative or suitable alternative for them. So likewise, they can take their own decision. So definitely counseling kind of helps these individuals to come to that conclusion.
Okay. So those are the questions from my end. Would you like to add any points from your end, ma'am?
Have dealt with most of the questions. I will just like to add a little bit about, we have talked about counseling the individuals or the patients who come for treatment with us. So, but there is an important aspect about counseling of the donors also. So especially the donors who come for oocyte donation. So these individuals also need to be counseled about what the entire treatment is going to be. How many days of injections they need to take, and how the procedure of oocyte retrieval, what are the risks involved in it, what is the risk of if a patient is a PCO patient with excessive like ovarian hyperstimulation, what is the risk involved, and how are we going to deal with it. And post the retrieval, if any complication does arise, then the donor, according to current law, needs to know that the couple who is taking those oocytes are going to take care of that donor. And coming to counseling of a surrogate, the surrogate needs to know that the entire cost and the care of the entire conception period, the pregnancy and delivery is going to be taken care by proper people, but that according to the legal and ethical application, she's going to have no control over the child that is born. So the baby that is going to be born is going to be legally given to the individuals whose sperms and oocytes have been taken from.
Okay. So may it be like a self cycle or a donor treatment. It is basically important for the counselor to be in touch with the patient throughout and make sure that the journey is completely comfortable for the couple, because they have to face many physical, medical issues during that, or maybe side effects during the treatment. So it is important for the counselor to be in touch with them and maintain that connect with them, right?
Yes, so the counselor does play a very important role, as we have seen in the overall, each and every step of the IVF treatment. And they kind of, the counselors, I think, kind of better can emotionally connect to these patients. They can understand these patients better, and they can have a strong bonding with these, so that it's kind of helpful for these individuals to carry their journey forward.
Okay.
Okay. So we have Apurva, who is the counselor at the Oasis Fertility Center. So Apurva, just for viewers, I will just like you to explain in short about the counseling process. So when an couple comes to you, how do you counsel them? What are the implications? What are the problems that you face? What are the common questions that comes through you, especially when an individual is going for an IVF cycle with self gametes?
Yeah, so in a self cycle, when a patient comes, the main 2 points that they have are success rates and financial counseling. So when it comes to success rates, depending on their case scenario, we give them an idea like what the success rate can be, and if in case there is a failure, there is a chance of failure, what will be the next step, or what the doctors might advise them as a next treatment plan. And when it comes to financial, if they are like from a well-to-do background, then we can counsel them accordingly. But there are people who are like have a poor background, let's say, or less mediocre background, so then they can't afford these treatments, because IVF treatments tend to go a bit on the higher side. So we give them financial options like maybe EMIs, loans. So we counsel them accordingly for the financial aspect. Apart from those, the main questions patients do have are like whether they will feel any pain during the surgery or during the complete stimulation process, as we say. So we need to give them an idea about how the stimulation process will be moving, and then what all are the side effects they might face of the injection, what is to be expected, and if they find something which is not regular, then they have to tell us if there is any extra bleeding or any nausea they are facing. So that we have to give an idea. Then we give the idea about the duration of the treatment. Many couples come who are in a hurry to conceive, so we have to explain it to them how the treatment will move, how much the duration might be. So that is all in the primary sitting. Then when it comes to when the stimulation process is over or it has just started, then we need to counsel them about the pre-operative counseling, which we call. So in that we tell them about, like, we ask them or we get to know the history, whether they have any history with anesthesia, if they faced any side effects previously, or what risks they might have. And then for the husband, about the semen sample freezing, why is it important? So all that counseling needs to be done, and resolve their queries in order to make the patient relaxed and prepared for the ovum pickup or whatever surgery they are going through. And after the operation, generally it entails checking up on the patients if they are having any elongated effects of the surgery, and explaining how the next part of the treatment will move. Some patients might need another procedure in between the pickup and transfer. So we need to counsel them accordingly. In the donor treatments, choosing a donor treatment is a kind of a tough decision for many couples. Hence, when it comes to donor treatment counseling, we need to have a more sensitive approach regarding why the donor gamete is recommended. And most of the people have questions like, when they are going for a donor egg or donor sperm, what qualities do we look for in the donor? Whether we check about their medical background, whether we are sure about their clean medical record. So we tell them all the qualities that we check in donors and what choice they can have in it, in the choice of donors. So basically that. And when it comes to both the treatment, self or donor, consent is a very important aspect. So before getting the couple to sign the consent, we need to explain what each and every consent entails. It should not be like they are blindly signing it. So we need to explain them like what each consent is, like whether it is for anesthesia, then whether they have been explained the risks of anesthesia, for an example. So each step, each consent needs to be explained and then taken signatures of. And then be in touch with the patient from start to end of the treatment to ensure a comfortable journey we can make for them.
Okay. So Purva, just one more question from my side is, that stress in the overall IVF treatment. I mean, the IVF treatment itself is very stressful, and this kind of has an effect on the overall, treatment and the continuation thing also. So, do you think post counseling the patients are like kind of more comfortable and they're more, willing to deal with the entire process?
Yes, when there are like patients might or might not be comfortable discussing their minor queries with the doctor because they might feel embarrassed or they might just not be comfortable. So when they speak to the counselor, we sit with the patient and we talk and we connect to them on a very deep level, I can say. And so we ask them all their queries, whatever queries they have, might it be very small or big, but we talk to them and we make sure that the anxiety they are feeling is resolved, and they do feel better after talking, because when someone is addressing their concerns, it the patient feels good that there is someone to listen to them and to resolve their problems.
That's right. So thank you, very well said. So I think counseling does play a very important role in the overall thing. And our counselors out here have a role like in each step of the IVF journey. So like be it from the start right to the end, acceptance of the result, be it joyful or whatever it is. So definitely you people do play a role everywhere.
Thank you, ma'am. And thank you, viewers, for joining us. If you do have any more queries, please message us or visit us for consultation. We have 2 branches in Pune, one at Wakat and one at Kharadi. Thank you.
Thank you, Apurva.
Thank you, ma'am.
Okay, so we do have a few questions that are coming over. So the first thing is, why is infertility counseling important? So as we have already dealt with our section out here, ki infertility per se, as we know, is a very stressful condition. And every couple who's dealing with infertility has a different form of treatment available for them. So counseling is important primarily to help them understand that what problem they are dealing through, what are the treatment options that are available, what is the success rate of the treatment option that the person has been told about, and what are the alternatives. So kind of, this can help the individual take an informed decision as to which form of treatment they have to go through. Then counseling also involves, dealing with the emotional, the physical aspect of the entire treatment, allowing them to understand the entire procedure. Then coming to, procedural counseling, where the entire procedure and everything has been explained to the patient, preparing the patient to accept the results, and like if the results do not come out as expected, then making them ready as to accept what are the other treatment options available. And again, the last part and the most important, I think, is the financial aspect of the counseling, so the couple as a whole is ready for the entire line of treatment. So the next question is, how do you mentally prepare for IVF? So mentally preparing for IVF will be like, you have to understand that the IVF procedure is not like a one-time thing. Like it requires a long term, maybe 2 to 3 months of entire treatment will be needed. You will need, frequent follow-ups. You have to understand the overall success rate of the treatment that you're going to, go through. You have to be patient for the entire thing, maybe daily 10 to 12 days of injections, the operation procedure. Maybe things might not come out every time as expected, and maybe you might have certain obstacles which have to be attended to. So you have to be kind of mentally stable. You have to understand that there is a light at the end of tunnel, but you have to be patient for the entire thing. We do have our counselors to help you in the entire journey, where at each and every step they're going to explain you how the entire procedure is, and if any help available, help needed, they're always available for that. So the next question is, how can an infertile couple counsel? So I think this question means that, what are the options of counseling available? So definitely, when every infertility setup does have a counselor, or we have other counselors also available who does counseling for the infertile sessions. So when a patient comes to the hospital for infertility treatment, the doctors per se, after the initial line of formulating the treatment and everything, they are going to refer the patients to the counselor. And over the line also, if you want some help from the counselors, they are available likewise. Okay. Next is, what helps with anxiety during the IVF procedure. So the prime thing that helps with anxiety during the IVF procedure is the preparedness for the procedure. You have to understand that this procedure requires this duration of time. You have to undergo kind of these line of treatments to achieving success, and only after going through these sort of treatments can you get your desired fertility results. So as you know, if you have the doctors, you have the counselors available. So whenever you have any doubts, whenever you have any queries or any anxiety related to any procedure, they're there to solve your queries. The if not the doctors, the counselors are there available, who have like a helping ear and can guide you in every form of treatment, or can connect emotionally with you, can empathize with you people, and be of help whenever it's needed for you. Okay. And the next question is, what are the most stressful stages of IVF? So coming to the most stressful stage of IVF, so I would suggest that the most stressful stage is going to get the time when you get the results out. So you have to be emotionally prepared during that time. You have to understand that that's not the end of everything. That if you get a negative result, definitely the success rate of any IVF treatment is going to be between 60 to 70%. So it's not 100%. So definitely you have to understand that if you do get a negative result, we have other options available. The other stages that can be stressful is the repeated follow up, the daily injection that needs to be taken, the oocyte retrieval procedure, and post oocyte retrieval where do have an embryo discussion on day 3 or day 5. What exactly, like how many embryos have actually turned out? Is the cycle actually successful, or they need to go for any other forms of treatment? Then again comes your lining stage where you're preparing yourself for the embryo transfer. So these are multiple stressful stages, but I think you have to take them one at a time and kind of prepare yourself for the entire thing. Okay, so thank you everyone. I think we can end our session out here.
Yeah, ma'am. Okay. Thank you.
Okay.